This is Our Lives. I'm Gwen Edwards. Today we are taking a look at the health care crisis surrounding Black maternity care. Did you know that African American mothers, women of color, are 3 times more likely to get sick and die during their maternity care? And that's compared to all other expected mothers. So why is this happening? My guest today will have some details for us. Dr. Rawlins is with Wellspark. He is the Chief Medical Officer. And we want to thank you so much for joining us today.
Thank you, Gwen. It's nice to be able to spend time with you and your viewers.
All right, so tell us, why is this happening?
The factors driving disparities in maternal and infant health are complex and multifactorial, as you'd expect. And they include differences in health insurance coverage, access to healthcare providers, socioeconomic factors such as jobs, housing, discrimination, as well as historic and ongoing racism. All these things play a role in affecting disparities in health for women and their babies.
This issue has hit the White House. There was a White House conference on this issue. So some of the initiatives that are being launched to help reduce the mortality rates.
And I think many of the things that are going on are going to work down, I'm going to call them basic things. One is make sure that you have health insurance. Health insurance in America allows you to have access to healthcare providers and good healthcare. Next thing is to make sure you have adequate nutrition. With a growing baby, it's very important to make sure that moms as well as their babies have adequate nutrition, as well as education and information. In the old days, I'm dating myself, is when moms were pregnant, they would talk to their mother or their grandmother, and they would tell them all the things you needed to know. It's very important to advocate for yourself and your family. No one cares more about your business than you do. It's critically important for individuals to be able to talk to their doctor and make sure that their doctor understands their concerns, their worries, their fears, and is able to address those. And if you're not able, you have to sort of stop and say, doctor or healthcare professional, you're not listening to me.
Well, Dr. Rawlins, we thank you so much for your time and your expertise.
Thank you. It's wonderful to talk to you, Gwen, and I hope that this is helpful for you and your viewers.
And we want to thank you for watching Our Lives. Just a reminder, if you have a group, organization, event, topic that you would like to discuss, contact me. My email address is gtedwards@news12.com. For Our Lives, I'm Gwen Edwards.